Hey, Doc.
Hi, Bruce Wayne. So, what seems to be the problem?
Well, lately I've been experiencing pain in my chest, and after having a night out with the boys, I went for a jog and suddenly my chest felt like it was going to explode. I've also been sweating more, and I felt shortness of breath.
Out of 10, what would you rate this pain? 10 being the most excruciating pain that you've ever experienced, and 1 feeling like a pinch.
Yeah, definitely a 10.
And has this occurred more than once?
Oh yeah, it's happened twice.
Well, it says here that you're 42, weigh 130 kilograms, and you've been drinking and smoking for 20 years. At your age, it isn't common for men to lose their fitness. How long would you say you've been feeling this pain?
Since early August.
Okay. Could you explain to me your weekly lifestyle? Give me your occupation, how many cigarettes do you have, and what kind of food do you eat on a weekly basis?
My occupation is a bricklayer. I smoke about 5 cigarettes a day and have about 3-4 beers a week. Also, sometimes on the way back from work, I like to pick up McDonald's.
Okay, I'm going to do 3 tests to diagnose the cause of your chest pain. I'll start with a blood sample just to make sure that your cholesterol is at a normal level, because it seems that your diet is introducing a lot of lipids. Then we'll have to test your blood pressure to make sure that it isn't too high, and make you sit in an electrocardiogram to test your heartbeat and make sure that the rhythm is regular.
So, how long will it take to get the results back?
It can take between 1 to 2 days for blood results to come back, but with the other tests, they can give you the results straight away. So after these tests are complete, you can go home and we will contact you with any information that we find, telling you to come in later, provided that we don't find anything abnormal or irregular.
Oh, so doctor, have you diagnosed what's wrong with me?
It seems you have atherosclerosis, otherwise known as cardiovascular disease.
What parts of my lifestyle and diet will I have to change?
Your test says that you have very high cholesterol, which is the reason why you also have high blood pressure. The results from your electrocardiogram tells me that your heart is beating faster than a normal rhythm due to your cholesterol restricting blood flow to that organ. And if you don't change your diet or exercise regime, your heart will start to fail and lead to heart attacks, strokes and several other diseases, which affects 50% of Australia's population and 1 in 6 people. However, to minimise the risk of your heart failing, you need to change areas to your lifestyle and diet.
Is that bad?
You have to try and quit smoking and reduce your alcohol intake, as well as limiting the times that you eat fast food. 60% of the people affected by cardiovascular disease are overweight, and a further 30% more drink and smoke alcohol, so those 3 factors are affecting your exposure to the disease. I recommend you to a nutritionist so he can have a look at your diet so that you can reduce your intake of LDL cholesterol. I'll also prescribe you some low blood pressure tablets so that if you feel your chest tightening, you can take them to reduce some of the pain. I highly recommend that after 3 to 4 weeks of trying your new diet, that you try and exercise 3 to 5 times a week, and maybe go to bed early instead of spending some time with the boys at the pub. Most people don't realise that this is a silent disease that affects people and can develop over several years. You're lucky to be here today, and that you've only experienced tightening of chest rather than a stroke, when most people die.
Alright, thanks Dr. Free. I'll make sure to follow your advice.